Thanks for joining in. My name is Claire, and I am the Communications and Development Manager at VFN, and I'm excited to be here with Jamie, who is a co-director of our Family Support Program, and Molly, who is one of our family support consultants working within our Family Support Program. And today, I'm really excited to chat with these two specifically around our parent-to-parent resources and what's happening there, how COVID has played a role, and where they see those resources going in the next 6 months, year, even dreams of a couple of years down the road. So Jamie, I'd like to kick it to you first, just to tell us a little bit about the several parts of family support that works, specifically around parent-to-parent supports, and where they've been and where you're bringing it to.
Sure. Well, I mean, as you know, Claire, the heart of what we do at Vermont Family Network in the Family Support Program, especially, is we're parents connecting with other parents. We are the peer support, right? We're the family organization for the state of Vermont, and the Parent Match program. So we're the parent-to-parent USA chapter for Vermont, and I would say this program was really robust years ago when we had staff that were dedicated just to making parent matches. Every day, that was their job. And I think as the training requirements, we kind of felt like it was maybe more of a burden on families. Families got really busy, not having time for training. The needs within the organization, I think, grew in that the program just expanded. There was a lot more work happening. Families on a individual level had a lot more needs. And so I think our focus shifted a little bit to try to meet the needs of everyone. And so our parent-to-parent program, although still has always been there, has never gone away, I think our focus kind of left a little bit. And so we're at a point that we would really love to see that program come back.
Mm-hmm. Mm-hmm. Because, I mean, certainly at VFN, we believe, families who have experienced these things with their children are the strongest people to be able to support other families. And our staff, both of you, are parents of children with special health needs, and so you've been in the mud of it all, and so you can really speak to that. Molly, what is it that you are hoping for when you're looking for parents who will be on the support side of parent matches?
Well, we're looking for parents who have been through it, but are at least a little bit distanced from the, worst part of the experience. When you first get a new diagnosis for your child, that's not a good time to try to support someone else. We usually, I think the best practice is considered about a year out from diagnosis, if possible. So just where parents are at a point where they feel like, I went through this, I came out stronger, I'm ready to give back and help other parents through that process. So that's what we're looking for, is people who are feeling like they're on the other side of it enough to be able to reach out and support someone else.
I would imagine a parent perhaps could at some point be too far from it as well. If it's a situation where maybe systems would have shifted, or systems or practices, do you find that that's a concern ever?
Well, we usually ask when people decide to become a support parent, ideally they'd be committing to about a year of being a support parent. Beyond that, we would check in and see if they're still willing, but we always call the support parent first before making a match to make sure that they're in a point where they're able to do that, because sometimes family situations change and things get really sick, or they're really busy, or sometimes they just feel like, I'm kind of, at a point where I don't know that this would be relevant at this point. So they're always welcome to disclose that as well.
So when a parent signs up to be a support parent, they're not necessarily signing up to have people just call them.
No, no, it's always a parent match. So we're matching a support parent with a referred parent. And it's a little more official than that. So we would be contacting both parents first to get consent, and before we would share their contact information with one another.
But, you know, Claire, it's not uncommon for parents to come in with a young child as maybe receiving support themselves. Then that turns into them wanting to give the support. And then as their child grows up, you know, systems might change, but experiences are still there. Maybe behaviors are still there. There are still things that happen along the, you know, the life that are very relevant across the lifespan. So you might have somebody that wants to talk about transitioning from, you know, early intervention to school, and then you might have an adult that's transitioning into adult care.
Oh, right. Yeah.
I think that there, you know, one support parent could be with us for years and years because their experiences raising a child are so relevant across the lifespan.
It's a great point. And you know, and certain things are really about a diagnosis specific, and some things may not be, like transitioning from early intervention to school or into some of those adult support programs. I would imagine everything is completely unique, just like all the kids that we work with. I'm curious of what do you see as some of the benefits? What have you seen as some of the benefits of parent matches for the families that we get to serve?
I mean, I can speak from personal experience, having received the support myself, and I left that 2-hour meeting with my support mom feeling like I was not alone. Somebody completely understood what I was going through, having received the diagnosis information, what I was about to go through. Somebody that could, you know, give me a hug and really kind of help me prepare for what was, you know, about to happen to my family. And so I think most important for me, it was that we were not alone.
Right. Right.
That's what we hear from families, is that it's just that opportunity to talk to somebody who gets it, and that, you know, that feeling of compassion and empathy from someone who's not a provider who's helping them. It's someone who's going through it themselves. So the empathy, I think, is stronger that way.
And I know I've heard, we've always talked about the theme of isolation of a parent, of a child with special needs for a lot of reasons. And even of people who love them, you know, grandparents, aunts, uncles, neighbors, friends, because if they don't understand, they aren't necessarily able to give the kind of support that someone who has been in those shoes can give. And you think, how can you be isolated? You have all of these great people in your life, but someone who just hasn't been in those specific situations, really, that's why parent matches are so important.
Well, I think too, the other side of that is, even if those supports are there, the person going through the experience may not be at a point where they want to accept those types of supports. Sometimes it can feel a little bit like pity. Sometimes you get tired of the attention. And so talking to somebody who, again, really gets what they're going through and can really speak to the specific experiences, it's a very different type of support than you would get from, say, a grandparent who's, you know, I'm so sorry this is happening. Sometimes that feels good, but sometimes you get tired of hearing that and you just really want to talk to somebody who can just jump right in and speak to the experiences that you're having.
So I'm curious about where you're seeing this going. What kind of people are you looking for? And used to be that this was done much more in person, which was probably somewhat meant people had to come to the office. They had to probably be located in the upper part of the state. And I think the technology that we're all using on a regular basis now is really opening this up so that we can be matching families really easily all around the state. Can you speak a little bit to where you see that going and your vision for the next, you know, period of time?
I would say, I mean, Jamie can speak maybe a little more about our database capabilities, because that shifted right around the time that I came on. So I'm happy to say I didn't have to deal as much with the clunky old database that we used to use. But I do know that we are working on developing a training for support parents. That's something that we used to do in person. people had to come in for a pretty lengthy session. Sometimes it was multiple days, and then it kept getting shortened over years. And so our goal now is to come up with a doable training that can be done via webinar so that parents can do it on their own time, and then also to continue to provide support to support parents, because the support parent also needs support via potentially Zoom meetings or some kind of format like that, where they can connect with one another, they can connect with someone who's been through the training and can answer questions. So we are trying to move towards a more virtual platform for that, which also allows us to reach out to more families further out in Vermont, which I think will be really useful.
And I think as we are taking the opportunity to kind of rebuild this program, simultaneously doing the outreach. And so one of our goals this summer and this fall will be continuing to connect with professionals in the hospital, UVM Medical, as well as Dartmouth, but also to expand that to OBGYN practices where, you know, moms, families might be receiving the news of a diagnosis for the first time, and that they know of the Parent Match program and could give families our information, offer to make a call on their behalf if that would be helpful to the family, but just so that the family knows that there is a system in place, that there is that support here in Vermont. And if it's a rare diagnosis, which it does happen, we do have access to a national database and a great support system across the country that we could, you know, look into that as well, as far as facilitating that match.
So if, you know, I feel like we could talk about this forever, but if someone is watching this or they know someone, how does a person get involved with this? How do they either reach out and say, I need a parent match, I just got a diagnosis, or I need support, or I really want to help other families?
We do plan on rolling out some sort of intake form, and whether that would be through our website or via email, it has not yet been developed. But for support parents, or for people who would like to volunteer with us and become a support parent, they would be able to fill that out. In the meantime, probably the best way to get in touch would just be to call or email us, and we can set that up that way and get the intake information we need, you know, in a less streamlined fashion. But in terms of getting support, so if someone is looking for a support parent, they can call us, they can email us, and then also online on our website, which is vermontfamilynetwork.org, if you click on Get Support, there is a drop down called Make a Referral. And so that's for anyone. That's not just for providers. It can be for social workers. It can be for families themselves. You can self-refer. There's a fillable form there, or you can print it out and fill it out that way. You can fax it to us or email it to us. We do ask that you try to encrypt the email just to protect your family's information, but then it will come to us. And that's for any of our services, not just for parent to parent, but that's a really good way for people to reach out and get in touch with us.
And speaking of little guys, we're just doing everything. I'm curious of, you know, we're still very much in Vermont in the midst of all this COVID stuff. And how are you seeing families coping and any, you know, kind of, how is this affecting some of the work that y'all are doing?
Jamie, do you want to cover that one, or do you want me to do it on your behalf?
Yanni,
no. So I did actually just run a report recently looking at the data as far as our parent matches pre-COVID, so January through March, and then March through as of a couple weeks ago. And we had 5 parent matches between January and mid-March, and then we've had 13 from mid-March till up till this week. And we have had an uptick in some requests for parents getting matched with other parents that have seen either behaviors at home related to COVID. And so I anticipate that this will continue, as well as, you know, parents wanting to connect with other parents, maybe around how is telehealth or teleservices going for you, and being able to connect around COVID related matters.
Yeah. Well, and zero doubt as we roll hopefully back into schools and back into daycares, more or not, because maybe a child is unable to because of being medically vulnerable, more and more needs are going to arise. And so it's awesome to know that the two of you are available, as well as our entire team of family support folks. And again, we could talk about this all day, but I really appreciate y'all taking the time to chat with me. And it was great to get a little vignette of Rylan in there. What do they call it when a person comes into a movie very briefly?
A cameo.
A cameo of Rylan. We had the picture behind him, but then the longer COVID hair Rylan.
Yes.
Which we all know about. So thank you, ladies. It was great to chat with y'all, and give us a call or shoot us an email if you want to learn more about and work that we're doing. Take care. Great to chat with you.
Claire. Bye-bye.